Hi, welcome back. This is the third video in a four-part series. Today I'm going to be talking about the specific treatments that can be available through hospice or palliative care. This has been a four-part series of videos designed to help patients and families who may be facing a serious or life-threatening illness. If you have been following this series and have been enjoying it, please be sure to hit the like button. Also, if you hover your mouse over the eye icon up in the corner of the screen and click on it, click on that icon, it will take you directly to my two previous videos. And be sure and subscribe so that you'll be able to catch the next one. It'll be released in about 2 weeks. So let's get started looking at what treatments are typically available for hospice and palliative care patients. So for the purposes of this video, when I refer to palliative care options, I'm referring to the treatments that are available through your HMO or your Blue Cross Blue Shield. And when I refer to hospice related treatments, that's going to be what's covered under Medicare Hospice Benefit. So to start talking about treatment options, we have to talk briefly about the differences and similarities between hospice and palliative care, because it's those differences and similarities that are going to change what is available and not available through each program. Hospice and palliative both focus on comfort care. In other words, they're focusing on comfort care because attempts to cure the patient's disease have remained unsuccessful. So it's comfort, not cure. The difference between hospice and palliative is who's paying for the treatments. 90% of Americans on hospice receive their hospice care through the Medicare Hospice Benefit. In other words, if they qualify for Medicare, they qualify automatically for the Medicare Hospice Benefit. If they don't qualify for Medicare or Medicaid, they can still receive hospice or palliative care through their managed health care plan or their HMO or the Affordable Care Act. Almost all managed health care plans will have generous coverage for hospice or palliative care because, quite frankly, it costs less money. It costs less money to keep patients comfortable rather than continue to pursue aggressive treatments to cure the patient. The other significant difference between hospice and palliative is palliative will continue to pursue some aggressive therapy designed to slow down the progression of the disease. Again, it's not a cure, it's comfort, not a cure, but palliative will try to slow down the disease, whereas hospice is strictly comfort, but there is a lot of treatments that are under just comfort, and I will get into those specifically in just a few minutes. So both hospice and palliative care focus on comfort, but palliative is going to focus on trying to prolong the patient's life, try to buy them a little more time. And the treatments that are typically available would be palliative chemotherapy, palliative radiation therapy, palliative surgery, blood transfusions, chest x-ray, CT scans, blood work, diagnostic exams, IV fluids, a tracheostomy, even a colostomy, or a CPAP for breathing difficulties, artificial tube feedings for a patient who's not eating enough. These would all be typically covered under the palliative care program. Again, I don't know exactly what's covered by your healthcare plan. Whereas hospice treatments are designed for comfort care. All the treatments that are listed in palliative for extending the patient's life or slowing down the disease process are not available under the Hospice Medicare benefit. That's because there's a mission statement under the Hospice benefit that says no treatments will be given that are going to either hasten or prevent the natural disease process. In other words, nothing's going to be done that's going to either hasten or prevent the patient's natural dying process. But these patients are still really sick and they still need a lot of care. There are thousands of treatments available, and I'm not going to list all of them, but I can start by lumping the medications that are available into different categories. Medications that are available through the Medicare Hospice Benefit are medications for constipation or diarrhea, for nausea or vomiting, insomnia, anxiety or depression, medications for shortness of breath. Under Medicare Hospice, shortness of breath is considered uncomfortable, and it will be treated and covered for like supplemental oxygen, like the nasal prongs, nebulizer treatments. Sometimes medications can help with feeling shortness of breath. And of course, there's pain management. And the hospice physician is an expert in that area. And I will mention one small fact that isn't readily known, and that is the hospice physician has an advantage in ordering narcotics. Sometimes a hospice patient is going to need a lot of narcotics to be comfortable, and they deserve all the medications they need to be comfortable. A hospice physician has those drugs available to him without question. Whereas a physician who's not associated with a hospice company or isn't really that experienced with this type of pain management may not feel as comfortable ordering those kind of drugs. So bottom line, the hospice physician is the expert, and he will be able to control the symptoms of pain and all other uncomfortable symptoms. Now, I didn't mention antibiotics. Some antibiotics are also available in the Medicare Hospice program, such as maybe some simple antibiotic for urinary tract infection. IV antibiotics are not available under the Medicare Hospice program because the care is being given in the home. And so typically needles and other aggressive treatments that typically would be done in the hospital are not practical in the home setting. And the patient wants to be at home. That's the whole point of hospice. So I want to talk now about how a hospice patient's diagnosis, their hospice diagnosis, can affect what treatments are covered under the hospice medical benefit. Many hospice patients have several different diseases. There is only one disease, though, that will be considered the terminal disease, the disease that's going to take this patient's life. As an example, let's say the patient is advanced congestive heart failure. Their heart condition is probably going to take their life in the next 6 months or less. That would be their terminal diagnosis. So anything involved with their heart-related, anything related to their hospice terminal diagnosis will be covered by the hospice Medicare benefit. If this patient, for instance, had diabetes all their life, hospice is not going to cover the cost of their diabetic medications because that's not their hospice diagnosis. Now, they can still get their diabetic medications and supplies through whatever HMO, or if it was Medicare that was providing their diabetic supplies, they will still get their diabetic supplies under Medicare or HMO or managed health care. It's just that the hospice benefit won't cover things that are not related to the hospice diagnosis. I hope I made that clear. Okay, I hope that I have been able to share with you some helpful information. If so, be sure to hit the like button, and you can check out the eye on the right hand side of your screen where you can see the rest of this video, the previous ones. This is number 3 in a 4-part series. I've taken an informal poll on what the subject should be on the 4th video, and that'll be coming out in 2 weeks. I am going to see if I can talk my social worker and chaplain from hospice agency to come and talk to me, if they'll get on camera, and can let me interview them about their particular aspects, the social and emotional and spiritual side of what they do. So I'll see you in 2 weeks.